Hi, I'm Dr. Brian Raskin, CEO and founder of Advanced DDS Dental Practice in Garden City, New York. And today I'd like to talk about 10 different things you really need to know about your dental insurance and your dental coverage. The dental industry has changed dramatically in the last number of years, and coverage really hasn't changed with it. I know expectations of my patients sometimes are unrealistic. So let's go over a couple of points and see if that can help people understand what to expect from their dental insurance. The insurance company doesn't work for you. I know that's hard to believe, but they're out there for their shareholders and their stockholders. What does that mean? To me, that means that they're trying to pay out to my patients as little as they possibly can. They have a tendency to turn down claims whenever they can. They're going to ask for more information as long as they can so they can delay payment. And they're really out there to pay you the least amount that your policy says they can pay you. So don't be surprised sometimes when procedures are turned down by your insurance, or when an insurance company says it's not allowed. It doesn't mean that your dentist isn't right in presenting the treatment to you. It just means that the way your policy is written and the way your employer has decided to allow certain types of coverage, that they're not going to pay for it. Not paying for coverage doesn't mean that the procedures aren't necessary. You need to trust your doctor. And you have to make a decision. Do I trust the dentist I'm going to? Or do I trust the insurance company in making decisions on my health? And in my personal opinion, you need to understand that if you don't trust your dentist, you need to go to another dentist. Another thing you need to know is that if you have an HMO, how HMOs work. A lot of offices don't participate in HMOs, and this is why. The way these plans work is they give the office a certain amount per patient per month. So let's assume a doctor has 10,000 patients in their practice that signed up to their office through the HMO. And they get $15 a month per patient whether they show up or don't. So they're going to get $150,000 a month from their insurance company to take care of those 10,000 patients. It behooves that office to do as little treatment as possible on those patients in order to maximize their profit. As soon as they start doing a lot of treatment on a patient, they're losing money, even if there is a small copay. That's one of the reasons a lot of offices will not accept HMO as coverages. The offices that do accept HMOs, I have found that patients have to wait a long time for appointments, that their dentistry is very basic dentistry that's provided, and that the patients really aren't benefiting from full dental health and dental care when they're going to an HMO office. And they need to understand that. You get what you pay for in dentistry, and yes, it is helpful, and there are a lot of people that need to go to an HMO office, but just realize that it's not the same type of coverage as if you're going out of network and you're getting procedures that are paid for on a fee-for-service basis. The next thing I want to go over is if you go out of network, you might not have to pay as much as you think as if you go in network. A lot of people think that they're going in network and it's going to cost them much less. Very often preventive charges, which are x-rays and cleanings and checkups, are covered at 80 to 100% if you go out of network. Whether you're in or out of network, sometimes the cost out of pocket is very similar. Other procedures out of network can cost you a few dollars more, but it's not going to cost you a tremendous amount more. Depending upon how your plan is written, whether you're a fee schedule, whether they go by percentages, these are things you need to know. But just remember, sometimes, again, you get what you pay for. You go out of network, you have an office that has the ability to give you better care than not just a basic dental office, and that the quality of the work that is done or the materials might, in some cases, be superior. It's not apples to apples, and you need to know that. A lot of people consider dentistry as a commodity, that you can go anywhere and you're going to get the same thing. That's not really true. I mean, if you think about it, if you needed heart surgery, are you going to go to the cheapest heart surgeon? Probably not. Well, if you need extensive dentistry, and you're going to go to the cheapest doctor out to do it. Again, it's probably not the smartest thing to do. But it's up to you. It's up to the patient. You have to also realize that the dental office that you go to doesn't work for the insurance company. Even if it's a participating office, they work independently. So that offices that are out of network, such as our office, we try to get back as much benefit for our patients as possible, but we don't have control over what is covered, how much of it is covered. There are thousands of different plans out there. Each person can come in with a different plan, with different coverage, with different percentages, with different fee schedules. And since we don't work for your insurance company, sometimes it's very difficult for us to come up with those numbers. So do yourself a favor, before you go to a dentist, before you get to their office, try to find out as much about your insurance as possible. If there's a fee schedule, bring it in with you. If it's a percentage, try to find it out. Don't blame the office if they can't get the information, because what we found here at Advanced EDS is there are a lot of insurance companies that will not even give us information over the phone, or sometimes we can't log into the websites on the computer and get it. Be your own advocate. Bring in that information, and the office can much better assist you in what type of coverage you have and how much it will help you with your dental bills. And again, don't expect your dentist to know everything about your coverage. We try our best, we really do, and a lot of offices do the same thing. A matter of fact, there are insurance companies now that are writing on your statements when you get them back, that if you go to an in-network office, it's going to be cheaper. Now just remember, cheaper is not better. They're not telling you that the dentists in those in-network offices have exactly the same experience, or that they're using the same quality materials, or that they're sending your lab work to as good labs. What they're telling you is that it is cheaper. It will cost you less money, but they're in no way telling you that what you're getting is going to be the same or it's going to be better. Most often it's not going to be better. I mean, there are plenty of good offices out there, but just remember again, you get what you pay for. Dentistry is a very difficult profession because it's very expensive to run. You have high-tech equipment in offices, you have high-quality laboratories, you need to pay your staff well, and if you start cutting corners, if you say to me, where can I get it cheaper, what I would say to you is, where do you want things to be cut in the quality of our care? I've never been able to figure that out, but if you need to cut your quality of care, then you might have to find an office that's less expensive. We just talked about this before, that there are offices that just pay on a fee schedule. Those insurance plans that pay on a fee schedule often pay very, very little towards your coverage. So be aware of the type of plan you have and the type of coverage you have. And if it only pays $10 or $15 on a procedure, that's great, it's better than nothing. So look at it as a supplement. Look at it as somebody's helping you out with your fees and with your bills, but don't look at it as it's supposed to cover everything, because there's no way when plans cover on fee schedules, they're going to cover even the overhead necessary to do your dentistry. Something really interesting to think about, I've been in practice for over 30 years, and when I started practice about 30-something years ago, dental insurance paid out $1,500 a year towards your services. $1,500 in the 1980s covered maybe 3 or 4 crowns. Now, in 2017, dental insurance covers between $1,500 and $2,000. Everything's gone up in the last 30 years with inflation. What hasn't gone up is the amount of reimbursement you're going to get from your dental coverage. So just remember, they're playing games here. They haven't raised their reimbursement in close to 30 years. So don't expect them to cover everything that you think they're going to cover. It's a supplement, it's a help, and it's great to have, but you need to remember that it's not probably going to take care of all your dental needs. Every year, insurance companies are reducing benefits. You might not know that, but us as dentists get notification all the time. A matter of fact, Delta Dental just sent out to their participating dentists that they're going to drop their fees by 15% next year. Up to 15%. Think about that. You're going to go to their office. Where do you want those participating offices to cut the quality of care to you? Because it is a business. If they're getting their fees cut by 15%, they're going to have to cut somewhere. They're going to have to change materials. They're going to have to do something different in order to give you less time for your cleanings. Somewhere, something is going to have to be cut down in order to run a business. Where would you like to have that cut if you go to these type of offices? Just remember that. Dental insurance work very hard to deny claims. What does that mean? It means that we'll send in claims, they'll say they don't get them. We'll send them in again, they say we don't have all the materials that we need. We send the materials that they need, and sometimes they deny coverage and it needs to be appealed. They are working very, very hard against our patients in order to give us reimbursement. At Advanced EDS, we really work hard and do our best to get as much coverage for you as possible from your plans. But just be aware, it's not so easy. The industry has changed so dramatically that they are working harder and harder not to pay claims. And remember that the quality of care and the expertise of the dentist isn't listed in the books. So when you get a book of a participating office and you're told that it's going to be cheaper there or they're going to be on your plan, just think about it for a second. Do you want somebody who maybe is right out of school, who has 1 or 2 years experience? Or would you like to go to an office where combined you might have 80 to 100 years of experience between the doctors? Anytime you're evaluating for periodontal disease, you're doing reconstruction, those examinations are the most important part of your visit. And I've had patients go, oh, it's just an exam, it's just a cleaning. In my eyes, as a dentist, the most important visit for my patients is that examination visit and that evaluation visit. I want to know, do my patients have periodontal disease? Do they have extensive cavities? Are there infections present? What is their bite like? What is their occlusion like? All these different questions are evaluated during that first examination. So don't think that that examination and cleaning is irrelevant and anybody can do it. The better expertise the dentist has, the more experience he has, the more he's probably going to pick up problems and treat them earlier. And remember, if we treat them earlier, they cost you less and they're easier to take care of. The end of this is just here at Advanced EDS, we do our best to keep your dental health as optimum as possible. Our goal is for you to keep your teeth and your smile for a lifetime.
Thank you for watching. If you like this video, be sure to give it a big thumbs up and share it to your social media. Don't forget to subscribe so that you can see more videos related to your oral health. And make sure to click the bell so that you're notified when we upload new content.